Innovative content. Global audience.
The Federal Capital Territory, Abuja. We're reaching you live from our SRO TV studio here in Abuja. Now, this is our health, where we talk about your health, my health, and of course, our health. You know the saying, health is wealth. So in this show, of course, we bring you issues bordering on our health, on our personal life, and everything that has to do with the human system. I have with me here on the show, I'm not alone today. I have with me a doctor here, Dr. Vivian. You're welcome to the show. How are you doing this morning?
I'm doing all right.
I can see that. And so today my topic is it's quite interesting one, something that has to do with everybody. A lot of people, when we hear the word urinary tract infection, UTI, a lot of people think, we know it's more common with women. Of course, that is why I have a doctor with me here on the show today. Before now, I used to think it's something that has to do with just the ladies alone, but maybe she's going to enlighten us more on this infection. And this is something that occurs in your bladder, and infections that also involve the kidney. Now, how serious is this? What are the symptoms? What are the treatments? And at what point do you have to call out to your doctor? Now, you're welcome to the show again, once again, doctor.
Thank you. Thanks for having me.
You're welcome. So now tell us, what is this urinary tract infection?
So, a urinary tract infection, or UTI, as it's commonly called by most people, is an infection of the urinary tract. So the urinary tract is consisting of, I would divide it into like the lower tubes, the bladder, the upper tubes.
But speak in a layman's language.
That's what I'm saying. I would divide it into like the lower tubes, the exits, the bladder, the upper tubes, and then the kidneys. Okay. So any infection that affects any of the routes where the urine passes from where it's produced in the kidney down to where it exits the body, any infection along that tract is called a urinary tract infection.
Okay. And now when we talk about this infection, is it just basically something that affects women? Because we have the mindset, we the ordinary people, we that are not in the medical field. A lot of people think it's just something that has to do with the women alone.
No, on the contrary, urinary tract infections don't affect only women.
Okay.
It affects different people of different gender, both male and female.
Okay.
And cuts across people of all ages, from children, newborns to
even newborns, children.
Yes,
I never heard that.
Up to the elderly. So
wow.
It doesn't it's not specific to just a specific gender, a specific age group, or anything like that. Although women tend to be like about 70-80% of the cases mostly affect women. But then that doesn't mean that men don't get affected or children don't get affected. It affects everyone.
Okay, now how do people contact this infection?
Okay, so there are several risk factors that can predispose somebody to having a UTI. So and most of them are not neither gender specific or age specific. But the most common thing that can make some cases or scenarios that can predispose someone to having a UTI are hygiene, the personal hygiene of the person.
Okay.
And another one is like for people who their immune system is not the best.
Okay.
So these are people who have like long-standing diseases like diabetes, cancers, people who are on medications that suppress their immune system. So several other conditions that can lower somebody's immune system. And then also there are some situations where for people who have been admitted in the hospital for one reason or another, they have to get catheterized. So that is when a tube is passed through the external opening, the urethra, into the bladder to drain the urine, or for any other reason why the catheter was passed. So during this process, it could introduce bacteria or fungi or whatever it is into the bladder and cause an infection that can go up to affect the kidneys as well. And then there are some other cases where, like in for people who their urinary tract didn't form properly when they were born, or maybe in adulthood, one thing or another happened, and there's some kind of like misconnection between the urinary tract and some other part of the body that it shouldn't be, they can be exposed to having a urinary tract infection.
Okay.
So there are actually like several things that can make someone have a UTI.
Okay, now what are some of the risk factors when we talk about this infection?
So, like I said, the causes and the risk factor almost like a very thin line.
Similar.
So, but then like for the causative agents, for causes mostly is bacteria that cause, the major thing that causes an UTI is a bacteria. Bacteria, there are different types of bacteria that can cause it. I'm not going to confuse you or bother you with all that one.
No, maybe some of the viewers might understand, So this is
so for example, most of them are most common ones are E. coli.
Okay.
The other ones, there are several other ones, but that's the most popular one that causes UTI. So, like for example, sometimes when someone goes to the hospital, they do the culture, they do a urine culture, and it comes back with something like staph, for example. Staph can cause a UTI, for example, but the chances of it causing a UTI are very slim. Most of the time when you see it, it's maybe because the sample wasn't taken properly or it was contaminated with one thing or another.
Okay.
So that aside, if the person's immune system isn't strong, like I said earlier,
it's weak.
Yes.
Okay.
They are predisposed, they are at risk of having an infection.
Okay.
If they have a catheter in the were catheterized for whatever reason and it stays for a prolonged period, it can also cause. And another group of people that are at high risk of having an infection are pregnant women. Why? Because during pregnancy hormones kind of like relax a lot of muscles in the body, and the bladder muscles inclusive. So the relaxation of the bladder muscles makes the urine stay in the bladder a little longer than it should, and this staying in the bladder for this prolonged period of time causes the bacteria there to be able to multiply more than the normal rate that it would be permissible or that the body can be able to handle. So it becomes overwhelming, and because of that, it can now easily like predispose the woman to having a urinary tract infection. And then also like cases like people who are diabetic, their defense mechanisms, like their white blood cell, for example, is not functioning at capacity. So even the slightest amounts where that someone else would be able to deal with, they won't be able to deal with. And then in other people, like people who have immune issues like HIV, for example, their bodies, the defense mechanism is also not at best. So for them, the organisms that can easily make them to have infections, besides the bacteria, they can also have like a fungal infection. So these are the other things.
Before we move forward now, what is the difference between this UTI and then the fungal infection?
So the thing is, it depends on what is causing it.
Okay.
A UTI could be caused by either a bacteria or a fungus. And the most common fungus that can cause the UTI is the Candida. So the fungus and the bacteria cause different types of UTI, but the symptoms are largely the same. It's just what is causing it that is going to make it different from how it will manifest and what is going to be used to treat it as well.
Now, what are some of the symptoms of this infection?
Okay, so for the UTIs, the most common symptom that people would present with in the hospital, or generally people who are having an infection would present with, would be painful urination. Sometimes not painful, but like a discomfort. When you try to urinate, you feel that discomfort. Normally, you wouldn't feel it, shouldn't be, but when you go to urinate, you're feeling feeling uncomfortable. You're feeling burning when you urinate. And also, some people may have like cloudy urine. So that's when you urinate and you see that your urine is not clear. The color is like having some kind of milky texture to it, and it's even some cases it may even like have a foul, like the odor would not be what you normally would experience when you urinate, and then others can have like a lower abdominal pain. Then also if it ascends, so when like as the infection is ascending, some people may have like pain in the flank pain. So that's when you have pain in this area of your back that would like move down to your like lower abdomen.
So usually it starts from the back. No, that part.
Okay, yeah, it starts from the back, moves down for most people, and then or some people would have like a fever. So that by the time most people are having fevers, it's already becoming overwhelming, or maybe like the kidneys are becoming involved and all that. That's where most people will get the fevers. You could get like generalized body weakness. You're not quite feeling yourself and all that. So majorly those are, and also I forgot one, the number of times you go to urinate in most cases would increase. So let's say yes, yeah, during the day you would urinate on a normal day when you didn't have any infection, you would urinate like 2 to 3 times, but now you see yourself going 5 to 7 times in a day. And even at night, you're having to wake up more frequently to go and urinate, when usually you wouldn't even wake up at all to urinate. Yeah. And then coupled with the pain and then the discomfort when you urinate.
Wow. So in all this you've said, at what point do a person needs to see a doctor?
So a urinary tract infection should be taken seriously by anyone who has it, because kidney issues are issues you don't want to have.
That is right.
It costs though. It's very, very you have damaged kidneys. Anyone who has kidneys that are not working properly, they will tell you that you should take care of the ones that you have. So anyone who notices any of those symptoms that I mentioned previously, the best thing to do would be to visit the hospital. Rehydrate, drink a lot of fluids as much as possible. When you get to the hospital, you would explain all the symptoms to the general physician that you're going to see, who would start you on some medications. In most cases, we would start you on some medications before we even see the results of some of the tests that we're going to send you for. So you are going to be a couple of tests will be run, a blood test, and most importantly, urine tests are going to be done for you. Depending on what symptoms you have when having this infection, sometimes scans can even be requested for, because sometimes it may be like a kidney stone that is causing you to have the infection. Sometimes it could be, like I said, like some malformations that are making you to have this infection. So some scans may be requested for, but the most important ones when you present the first period would be the urine test and then the blood test that would be done for you.
Wow, you said quite a lot, and there's something we still don't understand. We the lay people, like the callers, we're not in the medical field. Yes. Now, when it comes to which is toilet infection, do you have a specific name for it? Because we're talking about infections.
Yeah, we've been trying to clear people's thoughts about this thing,
because that is what the one we're used to. When you just say you have toilet infection,
nothing like toilet infection. There's nothing like toilet infection. So I don't know where that
name originated
from. There's no such thing as toilet infection. Maybe it's because it's associated with the poor hygiene that people decided to give it that name. Because most of what is causing the infections are coming from the back. And so but generally toilet infection is it's a myth, I would say, because in medical terms, most of the time, when we refer to things, we refer to them based on their anatomical names or like
Okay.
their medical names.
Okay.
And there is no part of the body that is called toilet,
Toilet infection.
even though there is a part that is synonymous with, but there's no part that is called toilet.
Okay.
So you may be having people who are claiming or say they have toilet infections may either be having a UTI or may even be having some other form of infection that has nothing to do with their urinary tract.
Okay.
Maybe it could be with their genital system. They're having like a vaginal discharge or something, and then they would call it a toilet infection. But really, the people, you cannot just pick up an infection from the toilet. First off, you didn't have whatever is in the toilet didn't have direct contact with you to say that okay, this could be possibly be what caused the infection. So please,
okay,
now,
we know that I know that while growing up to now, we know that anything that has to do with infection, especially concerning the women, sometimes you see people having inching stand there. Sometimes they have burn and all that. Now, what are the differences? And we notice men as well don't have these symptoms, and maybe they're having it as well. Why is it like that?
Okay, so for the itching, for example, the women, like I said earlier, more predisposed to having urinary infections. And one, that's because of how nature has created women. The for the men, the urethra, which, like I said, the exit is a little longer. Doesn't particularly have a direct connection to the other the anus, which is still in the same area. But the women, the urethra is very, very close to the vagina. So almost anything that affects the vagina can easily affect the urethra. And because of how the woman is set up, anything that's going on in and around the anus can easily like get carried up, have access into the urethra. So that's what makes it very, very like makes most of the symptoms that women have around that area intertwined, because one or the other may mix the other person's the other thing. So that's why.
Now, can any of these infections we've been discussing so far be transmitted via sexual?
Yes, definitely. Sex is one of the ways that it could be transmitted, especially for from the men, for example. It's one exit for both sperm and the urine. So if there's any infection up there and it mixes up with the sperm during intercourse, it could easily become mixed up and transferred to the woman during the sex. And also for the woman, it's if for whatever reason she's having a discharge when having a urinary tract infection, the discharge could get mixed up with the vaginal fluid and secretions, and during intercourse, the male picks it up during intercourse. So it could definitely be transmitted during sex as well.
Now, how do you even know you're having a discharge as a lady if you're urinating? Is it different or what?
Okay,
I don't understand.
Like for example, when a lady is on her period, you would know when the discharge is coming from your vagina, and you know that the feeling when something is coming from your urethra is different. So most times for the urinary outlet, it's when you are urinating most times that you would see the discharge. But while from the vagina, it could come out when the vagina pleases that it should come out, or when it has the vagina has carried its capacity. I'll be like, okay, let me send this one out now.
Okay. Well, don't go anywhere. I'm still here. We're discussing today with Dr. Ayogo Vivian. Of course, we have a lot of infections out there, things that are affecting people's health, and we're still discussing about the urinary tract infection today. Now, don't go anywhere. Stay with us. We'll be right back after this break.
RTV London, in partnership with NTA TV Enterprise, present the maiden edition of the Nigerian Week in the capital of the world, London. A wonderful blend of entertainment, business, and networking, displaying a wide range of arts, national cash crops, financial products and services, and real estate for huge extra opportunity in diaspora. Look no further. The 36 states of the Federation, the Federal Ministry of Information and Culture, Trade and Investment, the Nigerian Film Corporation, and host of others will be in attendance. Date 15 to 21st of May 2023. Venue Lighthouse, Camberwell, Southeast London. For details, log on www.superiorradiotelevision.com/Nigerian Week or call +447 549 513 619 or +234 814 358 2856.
Ladies, are you ready to shine? Here's a golden opportunity for you to show the world the queen in you, as the second edition of Face of SRTV Ladies Edition is about to begin. What are you waiting for? Register online with just 500 naira and stand a chance of winning a cash prize of 100,000 naira and the deal of becoming our ambassador. There will also be consolation prizes for second and third place winners. To register, kindly pay the registration fee and send your name, age, picture, and state of origin to this number 0906 895 2170. For more inquiries, please call 0907 400 7816. Powered by SRTV London, the face of SRTV.
RTV London, in partnership with NTA TV Enterprise, present the maiden edition of the Nigerian Week in the capital of the world, London. A wonderful blend of entertainment, business, and networking, displaying a wide range of arts, national cash crops, financial products and services, and real estate for huge extra opportunity in diaspora. Look no further. The 36 states of the Federation, the Federal Ministry of Information and Culture, Trade and Investment, the Nigerian Film Corporation, and host of others will be in attendance. Date 15 to 21st of May 2023. Venue Lighthouse, Camberwell, Southeast London. For details, log on www.superiorradiotelevision.com/Nigerian Week or call +447 549 513 619 or +234 814 358 2.
Ladies, are you ready to shine? Here's a golden opportunity for you to show the world the queen in you, as the second edition of Face of SRTV Ladies Edition is about to begin. What are you waiting for? Register online with just 500 naira and stand a chance of winning a cash prize of 100,000 naira and the deal of becoming our ambassador. There will also be consolation prizes for second and third place winners. To register, kindly pay the registration fee and send your name, age, picture, and state of origin to this number 0906 895 2170. For more inquiries, please call 0907 400 7816. Powered by SRTV London, the face of SRTV, who takes the crown.
That quick break, I am still here with Dr. Vivian. I call her the youngest doctor of all time. And of course, we're discussing urinary tract infection today. That is something that is very common. I have a caller with me here this afternoon. Good afternoon. Can you hear us? You're live. Good afternoon.
Hello.
Yes, we can hear you. Can you hear us?
Yes, I can hear you guys live and direct. So I just have a brief question for the doctor in the house. My name is Eme, by the way.
Okay, welcome, Eme. Okay, how are you today?
Okay, so I have a question. It's actually I just needed clarification, especially for viewers who are listening to this program, watching the program right now.
Okay.
Urinary tract infection, we have lots of myths. So that's to say it's when you overuse your pants, it can cause urinary tract infection. Some persons say it's sharing of toilets. Some will say it's I don't like, okay, if you overuse your pants, can it cause any kind of infection? And if you use public toilets, can it cause urinary tract infection? And finally, my final question is, can sex, unprotected sex, cause anything like urinary tract infection, and what kind? Thank you.
Okay, thank you for that question. So, I'm going to start with first the one of using prolonged usage of the same underwear. So, definitely, like I said initially at the beginning, hygiene is one of the top reasons or risk that can make you prone to having a urinary tract infection. So, you are using the same underwear for a prolonged period of time. There's definitely some stool that has touched that underwear. There's secretions from the vagina as a woman.
Sorry, we lost that call. I guess we're having a little bit of network issues. Hopefully, she will call us back this afternoon. Viewers, I'm still here with Dr. Ayongo Vivian, the youngest doctor I know. Doctor, so let's move forward now. Hopefully,
Okay.
she's going to call us back. But now, when we talk about this infection, you've talked about that it's not something like headache. You say it's fever. Let me take Panadol and see whether it will come down. So later, before I go and see doctor, you mentioned that you will have to see a doctor immediately. Now, what are some of the things people should do
Before?
Yes, before.
So first off, improve on your hygiene. So as a woman, for example, or even in children, make sure that whenever you go to use the toilet, always clean as a woman from front to back, not the other way around. Because if you do that, you're reducing the chances of you introducing whatever came out from the back into the front. And those are most of the things that end up causing the infection anyway. And even for children, when you are cleaning them, you always try to clean from front to back, not the other way around.
Okay.
And then also,
because I know we do that a lot in this society. People clean from back to front.
That's most of the time why you haven't come down with one is because your body is still doing the Lord's work. If not, if for whatever reason you are ill and your body's defense is not top notch, you're definitely going to come down with an infection. Although it may not come down frequently, but occasionally it may come in here and there. Yeah.
Now, we've talked a lot, but these people with this infection, what is it that what kind of treatment are they supposed to take to get?
Okay, so like I said, when you get to the hospital on your first visit, as soon as you speak to the doctor, your symptoms are going to make them start thinking in that direction already. So they are going to start you on antibiotics. So there are some common antibiotics that most guidelines recommend that we should start treating the patient with. So some of those antibiotics like trimethoprim and nitrofurantoin, and these ones are usually started before. Okay, so you get to the hospital, your urine sample is going to be taken first. Then you will be commenced on these antibiotics. Okay. You start taking them. Your urine test will be done. So there are 2 urine tests that usually would be done. The first would be a urine dipstick or a urinalysis, which would give proof whether or not there are some active infection in the urine or not. Depending on what the result of that test shows, it will now go on to do a urine culture, which would tell us exactly what
the level
what organism is causing the infection. So that would now inform our decision on which antibiotic the organism, or first that would tell us if it's a bacteria or if it's a fungus. If it's a bacteria, it will tell us which kind of bacteria, what kind of antibiotic is going to be best for treating that, and the other options that are going to be suitable if for whatever reason you are allergic or we cannot use that particular antibiotics for you. So
now, what is the difference between you kept repeating the word bacteria and fungus, something like that. Now, what's the difference between these two?
Yeah, that one is going to take us back to microbiology class. this the time you have is not going to be enough. So
maybe you should just show just a little bit of the ice.
What's the best? What's the easiest thing I can? Okay, so if I was most, I would say something that looks like a mushroom, for example.
Okay.
It's kind of like easy to squish but difficult to get rid of. Bacteria, on the other hand, there are also different types of bacteria. To a large extent, they are easier to treat. Although right now we're having issues with people abusing antibiotics. That's why I said, if you have any issue, please go to the hospital first. Don't just start any antibiotics. So bacteria are a little more easy to treat because of the presence of wide range of antibiotics that we can use for them. Meanwhile, fungals, we have like more limited options, and most of them are like difficult to treat. And most times when you see a fungal infection is because the body was unable to tackle it. And so that means it's going to be difficult. The person's immune system is not doing what it's supposed to be doing, so it's going to be difficult to treat it.
Well, viewers, we'll go on another quick break. Don't go anywhere. I'm still here. Like I said, I call her the youngest doctor, Dr. Vivian. We're discussing urinary tract infection. Now, when we come back from this quick break, we're going to continue with our discussion. Stay with us.
RTV London, in partnership with NTA-TV Enterprise, present the maiden edition of the Nigerian Week in the capital of the world, London. A wonderful blend of entertainment, business, and networking, displaying a wide range of art, national cash crop, financial product and services, and real estate. For huge extra opportunity in diaspora, look no further. The 36 states of the Federation, the Federal Ministry of Information and Culture, Trade and Investment, the Nigerian Film Corporation, and host of others will be in attendance. Date 15th to 21st of May 2023. Venue Lighthouse, Camberwell, Southeast London. For details, log on www.superiorradiotelevision.com/Nigerian Week or call +447 549 513 619 or +234 814 358 285.
Ladies, are you ready to shine? Here's a golden opportunity for you to show the world the queen in you, as the second edition of Face of SRTV Ladies Edition is about to begin. What are you waiting for? Register online with just 500 naira and stand a chance of winning a cash prize of 100,000 naira and the deal of becoming our ambassador. There will also be consolation prizes for second and third place winners. To register, kindly pay the registration fee and send your name, age, picture, and state of origin to this number 09.
From that quick break, I'm here with Dr. Vivian and we're discussing our topic today is urinary tract infection. Now, doctor, at what point do we have to be worried about somebody's liver? Because this is something that you said earlier, that he had some kind of connection, which I quite don't understand. Now, at what point this whole infection thing gets to the liver, and before you know it becomes a liver issue?
More like the kidneys.
Kidney?
Yes.
Okay, beg your pardon, kidney.
Yeah. So, like I mentioned earlier, the urinary tract starts from, if we're taking it from below, it starts from the urethra, which is the outer exit, your bladder, which holds the urine that is generated by the kidneys, then the upper tubes, which are the ureters, and then the kidneys that filter, that are like the filter house of the body.
Okay.
So an infection from anywhere below, from below, can ascend into the bladder, especially when there are some malformations, like I mentioned earlier. So especially like between the bladder and the kidneys, the ureters are supposed to have like a one-way valve.
Okay.
That permits only the fluid from coming up, down, the urine rather, from coming up to down, not down to up. But in cases where the urine is staying in the bladder for a long period of time, or maybe the valves are no longer working like they should, bacteria stays in the bladder and multiplies and becomes a lot. The body is unable to clear out all of them. Some of them would be able to travel back up into the kidneys. And when they get into the kidneys, the infections cause what we call fibrosis. This is like scarring. You know how when you have an injury and a scar happens?
Yes.
So that's a similar thing that happens to your kidneys, which is not good because the normally like how the cloth you used to sieve your kunu, for example, if it has any like knots anywhere, it wouldn't be it won't filter properly. So it's the same thing. Scarring happens in your kidneys. It's unable to filter the urine properly. So over time, those areas become problematic. Your kidneys start reducing the number of. At first, they will try to like overwork themselves to compensate for the scarring that is happening. Over time, it can only do that for so long. Over time, it will just shut down and stop trying to overwork itself. That's when you will now see people coming down with chronic kidney diseases that are having to need dialysis to replace the function of the kidney that they've lost already. Or sometimes it can even be as bad as going up to like end stage kidney disease, where the kidneys, the number of, even the dialysis is not really doing so much, so the person may even need a new kidney. So that's why protect your kidneys at all costs.
Okay, doctor. Now, when it comes to infections, now I've seen cases where people go for treatment, they go for tests, they do that culture thing they do, and then after the treatment is still there, and sometimes they will tell you it hardly goes away. So at that point, what are you supposed to do? You keep repeating the treatment, or you keep going back for tests?
Okay, so sometimes there could be organisms in the urine even after treatment, but there are no symptoms. So first off, the person would need to change whatever treatment that was used previously.
Before. Okay.
So if after changing the antibiotic, for example, that was used the previous time, it still doesn't clear it away. If it was tablets that they used the previous time to treat it, now we could start using some injections. Like intravenous antibiotics, because most of them have better penetration into the tissues and they help to clear it out much faster. And duration also of the use of the antibiotics will be prolonged rather than the regular 3 to 7 days. Maybe they would they could treat for like 10 to 14 days to give it more time to be able to clear out the causative organism much better.
Now, when we talk about these infections, I know a time that somebody that is very close to me had these issues, and then hers was serious, and they could not. Her body is the kind of body that they don't see veins. They try over time, and they said they can't do the vein thing, so they had to give her drugs now. And at that point, the doctors were insisting that the injection would have been more effective. So in that case, what do you advise as a doctor?
So in that case, she would have to get admitted. Because other options of getting venous access exist. So for someone,
really,
yes,
I didn't know that.
If you had an accident now, you are bleeding, I will have to find a way to have venous access now. So it must not be the ones like on the hands or on the legs. There are other ways that we could.
Maybe the head.
That's an option.
I thought that's for children alone. Really?
If your life is depending on it, if you have to shave off your head, well, so maybe if every other option of securing venous access doesn't work, peripheral access doesn't work, we may have to go like a central route. So that's where that's what we call placing a central venous line. That's a little more invasive and has its own risk, but in most cases you have to weigh the options, which one is better.
Okay.
And then also there are options of injections, instead like intramuscular injection that they give it in the muscle. So depending on what
the situation is
like, that would warrant what the decision is going to be when the person comes to the hospital.
Now, when we talk about infections, the caller was trying to ask a question earlier on.
Yeah.
So when you have infection, and probably you've been using your Hondas, and then even though maybe they are new or they are old, but now you find you went for test and the infection is there. And when you start treatment, now at what point are you supposed to discard do away with the Hondas? Are you still supposed to be using them after the treatment?
So that doesn't. The problem is how well did you wash them?
Okay.
So when you wash them properly and you use disinfectant solutions while washing them, you should be able to do away with most of those organisms that cause it, because most of them kind of like respond well to the antiseptic solutions that are used. So you just bleach if you have to.
Sanitize, sterilize, whatever you have to do.
You have to. Hot water is an option too.
Okay, so somebody have a question for you here. The person say, I have a friend who sees milk from her breast. She said it's toilet infection. Is this true or something else, doctor?
Milk from the breast is not a toilet infection. Like I said, there's nothing like toilet infection.
Okay.
So, a person is having milk from the breast. There are so many questions I would like to ask, but
Yeah, maybe she's pregnant or
yeah, okay, pregnancy, yeah, but is she did she just lose the pregnancy? Is she still currently pregnant? Is she breastfeeding? Did she just stop breastfeeding? What other signs and symptoms does she have? Sometimes there are situations where like hyperstimulation can cause people
Okay.
to, yes, and then sometimes it could be a more serious situation that could be making someone to have
Okay.
breast milk discharge from the breast. So ultimately, I would say find your way to the hospital. Your answers will be there, all the tests and examinations that will be done
Yes.
for you.
Okay, now is there anything normally when we have this is Africa now, you
Yeah.
can't take it away from us, that part. And then there are sometimes you have some you met and they tell you eat this while on treatment or after the treatment, take this, eat that. Now, is there anything you want to doctors prescribe when it comes to infection? Not just the medication, now something else you could eat that could help your body system.
So first off would be your hydration. Drink lots of water.
Water.
It helps to dilute everything that is there to help your body to
So
excrete.
it must not necessarily be water, but anything that is
Water, please.
water.
Because there are some
Okay.
people that if you tell them they should drink a lot of fluids, alcohol is fluid.
That is true.
They will drink alcohol and tell you they've clocked in 3 liters today. Half of it was alcohol. So water, please, preferably. But of course, you have other options like tea and fruit juices. And like specifically for the UTIs, there are some school of thought, or there's some studies that have suggested the use of cranberry juice, that it helps to improve microflora, so normal bacterial culture of the urinary tract. Although it's still like a debatable topic. Some people think it works, some people think it doesn't. But I mean, a little more vitamins and minerals never hurt nobody, so that's also an option. And of course, always vegetables, fruits, good vitamins, antioxidants that always like help to boost the body's immune system,
especially the immune system.
Yeah.
Now to fight back any bacteria or anything. Okay, doctor. Now, when we talk about the men, now we know that women, we are prone to these symptoms before we start having the symptoms, and men, they don't have it at all. Now, at that point, how would they know that they are carrying something, they have something in their body?
So nature has made it in such a way that for men it's even easier for them to even pick it up. Yes, because a small irritation in the tract, you would feel it. So for them, and it happens more frequently, a man would even pick it up faster than a woman would.
Really?
Yes, because the irritation is, because there's like a long segment where and it's like quite sensitive, so any irritation along that segment, the man is going to feel it. If there is any discharge, it's obvious. It's very, very obvious. Unlike in women, where if there is a discharge, you may be thinking, is this coming from the vagina or is it coming from the urethra? You are not quite sure. But for the men, it's always like almost very evident. The pain or discomfort on urination is almost always evident, and in both cases, that's almost always like the first sign that gives it away for most people.
So now when we talk about we're talking infection now, but we're talking about urinary tract infection. Now, when we talk about other infections from urinary tract, now is it the same symptom? A lot of people, we have something and mistake for others. For instance, when we talk about, you talked about staph, you mentioned something like staph. Yes, and then we have gonorrhea and all this. Now, is it the same symptom they have?
Okay, so like I said, sometimes there are like symptom overlap. So especially like for anything that affecting the reproductive system, most times would mimic something that is looking like a urinary tract issue. And then sometimes you're having a urinary tract infection, but it's mimicking something that could be looking like a genital infection. So most times when you get to the hospital, there are a lot of questions of we're going to ask. If we're asking you most of these questions, please don't think that we're trying to pry into your personal life.
Private life.
We are just trying to, get to the root of the reason why you are in the hospital. Nothing else, please. So please answer us honestly too, because don't be shy.
But a lot of people also, when it comes to anything that has to do, I once did that a test. I ran that test. All of a sudden, I started feeling weird down there, and immediately I told my mom. Then I was home. I told my mom that no, I'm going to the lab.
Yeah.
And she said, I should go and meet my doctor. I said, no, I want to first of all go to the lab and be sure, because I don't want to go there. And then he sent me back to. So I went there and I did. And a lot of people also would be shy, because that day I went to the lab, the place was open. What do you want to do? I said that this is how it is. Everybody started looking at me. Now these are some of the issues we have.
Yeah.
And you see people dying in silence. They don't want to say it openly. You don't know where your help will come from. But they feel that, of course, we live in a society where anything is said will be used against you. So a lot of people also shy away from the fact that these things could cause danger later.
Yes.
They don't know, like you said, that it could have issues with your kidney if not properly treated. And now, just before we wrap up the show, doctor, what are some this medication, antibiotics? You said a lot of people abused this. I'm going to even bring a pharmacist here on that issue. Like I said earlier when we were talking, I said there are names he called I couldn't even pronounce. And he said a lot of people use this and they forget that the way you abuse it, later it will not have no effect on your body, something like that. And now we know that anything that has to do with infection, must you use this antibiotics? There's no other way out.
There are some, like I said, hydration one most of the time would help to dilute.
Okay.
But then to deal with the organism itself, you would still need to. Your body's trying to eliminate it, but your body cannot completely eliminate it. So you have to. And you don't want your body to get overwhelmed by that organism. So that's the reason why we end up using antibiotics most of the time. Sometimes we may not use antibiotics if we feel like, okay, this is something that is mild. Your body can handle this, then we don't give you any antibiotics, because we try as much as possible, because we know how the issue of resistance is becoming. Most times you see someone comes with a urinary infection, you do culture, it grows something, and then you see that all the antibiotics that were tested, all of them are resistant. So you're not stuck between, okay, so what do you do now?
At that point, what do you have
What do you do? It's usually a very challenging case, especially if it is someone who is immunocompromised. Their immune system needs all the help that it can get to be able to clear it out. So please, like I say, please don't just be popping amoxicillin, because that's the one that people like to go.
And there was the other one. I know that one. I'm guilty. Let me say it now here. There's one other one. Is it? Not that one. There's one that has blue pack and white. They usually give to me. Most time. What's the name again? Cipro Tap or something.
Please don't. Because, for example, in this urinary tract infection, Cipro Tap is one of the most commonly, effective ones that would clear out most of the organisms that cause it.
Okay.
If you now are resistant to Cipro Tap,
that is problem.
That group now, there are not so many options in that group, and the other ones now are not readily available, or maybe the prices of most of them are not even cheap, even friendly at all. They're not friendly at all. So please, let's resist the use of unnecessary use of antibiotics. Not everything that demands antibiotics. Sometimes you just need to rest, eat well, and most of your issues would calm down. But if it's not calming down, you can come to the hospital. We're only waiting for you people.
But Nigerians as well, they like that sharp, I'm having a headache, my leg is swollen, I don't want to go to the hospital. They don't follow the due process. And some will tell you, I will go there, I'll be on queue or this to see the doctors, the problem and all that. And before you know, they just go to the pharmacist and they just pick up. And sometimes they won't even take the food dose, they will just take
that's another problem.
And then they drop
complete the duration, at least take it for at least 5 days. At least. Because when you start antibiotics halfway and stop it halfway, your the organisms you shoot them for a bit, and then they are trying to find how to get back on to survive, because it's the survival of the fittest. They are trying to survive in that environment as well. and then you suddenly brought something that would make them to destabilize the environment, and then all of a sudden you removed whatever you brought to destabilize the environment, they're going to be like, okay, so this is how this thing works. Before he comes back, let's change, let's reorganize our defense, and then they change their genetic structure to be able to resist the drug. And meanwhile, the drug was targeting what they changed.
Yes.
But when you continue your antibiotics, you don't give them time to go and reorganize and come back and come and resist your medication. So that's why always take antibiotics when it's necessary. If it's not necessary, please just stay away from it. It's not tic-tac.
Anyway, thank you so much, Doctor. So we've learned a lot today on the show's viewers. We know that the main causes of urinary tract infection. Of course, we know the symptoms and of course how to prevent, what to do, and when exactly to see a doctor. Now, we've learned from this show today also the hygiene is very important. Yes, that is the take home today. So whatever you do, this is not even for just the female folks alone, it's for both genders. So whatever you do, stay clean. Your hygiene must be top notch, and of course be on fluid, be on water. Not fluid, water, because doctor said even alcohol is fluid. So let's know what we're doing. Be on water always, and that has always been our tips on this health show. Of course, where we tell you to drink water, live healthy lifestyle, because health is wealth. Now, this program will come your way again next week. Of course, Doctor, thank you so much. But you'll be coming on this show now. You are the youngest doctor we have, and this place is for the youths, as you can see. So we'll bring her again. I've been on the show with Dr. Vivian. I call her the youngest doctor. She's brilliant, and of course, she's smart. Thank you for being on the show today. Well, it was quite enlightening today what all you said, and I bet also the viewers also learned so much today. And just before we go, don't forget our Nigerian Week London that is fast approaching. A lot of things are already gearing up for that event. Be part of it. You don't want to be left out. Get your ticket, get your stand, and of course we have a lot of ministries. We have a lot of superstars, artists coming on board already with us. It's going to be fun, the food, the music, the films, and of course the business opportunity. That is something you wouldn't want to miss for anything in the world. And just before we go, don't forget to hit on the notification bell, like our content, share our page, and of course invite somebody to that page. And while you're out there, stay safe, and for the drivers, please drive carefully, and remember, peace is priceless. Let's give peace a chance. This is Our Health with Princess KESSY. Until I come your way again next week, please be on. I don't want to say fluid again. I wanted to say fluid, but I know doctor is still here, so I can't say fluid because even alcohol is fluid. So be on water, be hydrated, and of course stay clean. You must take your hygiene level serious. Let that be your take home today. See you again next week. Bye for now.
RTV London, in partnership with NTA TV Enterprise, present the maiden edition of the Nigerian Week in the capital of the world, London. A wonderful blend of entertainment, business, and networking, displaying a wide range of art, national cash crop, financial